Los Angeles, and a Bachelor of Science degree in Business Administration from American University in Washington, D.C. She has served as a business leader, nonprofit board member, and a consultant to for-profit and nonprofit organizations. Dr. Watson studies trauma-informed settings and healing from an ecological perspective, focusing on a community and organizational context. She is particularly interested in systems that impact children and adolescents as they transition to adulthood, including child welfare, juvenile justice, and schools. And now, as we get started, remember that we'll begin with the presentations of the speaker, about 20 minutes, and then we'll open the floor for questions and comments. And with this in mind, I would like to hand over the floor to Dr. Watson. So thank you very much, Dr. Watson, for accepting our invitation today.
Thank you so much for having me. I'm happy to be here. And thank you to everyone who has shown up to listen to this presentation. So Esperanza gave me a great introduction. My top talk today is about social workers' responses to the trauma-informed movement in schools. So this research is part of a broader team's work. I partner with Dr. Ron Astor, Dr. Rami Bin-Banishi, and Dr. Gordon Kapp. I was the student of Dr. Astor and a recent graduate now of UCLA. So when we think about addressing trauma in K through 12 schools, there's been increasing interest in this over the last 20 years or so because of a recognition of the high prevalence of trauma throughout the world. I mean, there's estimates from about 2/3 to 80% of kids report at least one traumatic experience before the age of 18. And we know that traumatic experiences affect kids' ability to function in school, whether that's difficulties with memory, decreased language ability, attention deficits, decreased academic achievement with grade retention or absences, and higher rates of teacher-reported internalizing behaviors and externalizing behaviors. However, despite this interest, there's a lack of consensus about what a trauma-informed approach looks like in practice. And so far, there's been limited empirical study of whole school approaches to trauma. So what we decided to do is first start with a critical review of the 8 published models for trauma-informed schools and organizations more broadly that we found. And we identified 4 common components from those. And then we used those to develop some additional work studying how US-based social workers thought about trauma in schools and what kind of practices, policies, and climate they expected to see in those schools. So the consensus model that we developed from the 8 published models, which include the sanctuary model by Sandra Bloom, the trauma-informed service systems model from Harris and Fallett, trauma-sensitive schools by Cole and colleagues, compassionate schools by Wolpal and team, trauma-informed programs and organizations by SAMHSA, the U.S. Substance Abuse and Mental Health Services Administration, trauma-informed schools model from the National Center of Traumatic Stress Network, and the positive schools model from the University of Maryland, and then equity-centered trauma-informed education by Vene. The consensus model includes the 4 characteristics: understanding trauma and making a commitment to addressing trauma by all of the members of the school community, emphasizing the physical, emotional, and psychological safety for all members of the school. That's the kids, the staff, and the families. Taking a strengths-based whole person approach toward the staff, students, and families, because we can't expect teachers and other staff members to provide to the kids what they can't experience themselves in their workplace. And then finally, trusting, collaborative, and empowering relationships between the administration and the staff members, between staff and students, with the families and the broader community. So in our critical review, we just looked at publications from 2019 forward because there's two prior systematic reviews that covered earlier work. Maynard and colleagues in 2019 basically had an empty systematic review that showed 0 studies met their inclusion criteria for a whole school approach to trauma. And then Avery and colleagues found 4 whole school models that they reported on in 2021. So what we did that was a little bit different is we looked at every study that offered any component, any of the 4 components that I addressed on the previous slide. So what we found were 14 published papers overall, 8 of which only addressed that first component, understanding and responding to trauma. 2 more addressed that component as well as one other component. 2 more addressed school-based relationships, and the last 2 addressed whole school approaches. So as you can see, still not a lot of empirical work on whole school approaches to trauma. As a result of that, we decided to do a series of studies. This was actually the work of my dissertation. We did a survey of US-based social workers, school social workers, and that survey asked them about both practices and policies in their schools, as well as what their school climate was like. And then after those first 2 components were studied individually, we took a subset of that population, and I did 20 interviews with them about more broadly what makes a school trauma informed. So more semi-structured interviews, allowing them to just kind of talk about what they thought a trauma-informed school would look like and what components you would expect in it. So just a little overview of the population and sample from the first 2 studies. It was 90% female. I don't know how it is internationally, but in the US, that's pretty much what our school social worker population is. We had just over 7% male. 2 individuals were gender nonconforming, and a few more decided not to answer the question. Also, almost 3/4 of the respondents were white, about 12% Latinx or Latine, 7% Black, 4.3% multiracial. Some also chose not to respond. And then we had very few Asians or Native Americans or Hawaii natives. The school characteristics were basically across the board. We had most schools were in suburban areas, but we also had a fair number of urban schools and a smaller number, as you would expect, of rural schools. The school social workers reported working across the spectrum from preschool to high school, including alternative schools like non-public schools serving special populations. Most social workers worked in elementary schools, over 300 of them. Middle schools were about 260 of them. High schools were just over 240. And then there were 92 serving preschools, 69 serving alternative schools, and then 7 others. And most participants reported working in multiple schools. The schools were also generally high need. They reported that a mean of 64% of students received free or reduced lunch at the schools. Just over 50% of students were from historically marginalized and minoritized backgrounds. Just under 20% dropped out in their districts, and over 50% entered college. So study 1, the research questions were around policies and practices present in the schools. And we wanted to know not only what was there, but also if the presence of certain policies and practices could indicate whether or not that school was trauma informed. according to the social worker. Now, we have to remember that all of this is the perspectives of social workers, because there are no standardized measures or ways of declaring whether a school is trauma-informed or not. Our instrument was developed by the research team to just better understand the experiences of social workers in schools and how that related to trauma. The survey instrument was deployed shortly after COVID and the schools reopening, so that we have to expect that COVID had some influence on responses. We gave them a list of 33 policies and practices, from ones you'd expect in schools, like social emotional learning programs, a commitment to creating a positive, healthy, supportive school environment for all kids, things like that. And then there were COVID-related policies too, like, is masking still in place in your school? And then we asked, of course, participant demographics and school characteristics, as I reported already. For the analyses, we did the independent variables were the policies and practices present, and the dependent variable was, is the school trauma informed or not? And then we did some logistic regressions to follow up. So what we found is that participants in the trauma-informed schools, that is the social workers, were not statistically different in gender, ethnicity, or years of experience than participants working in non-trauma informed schools. So that's good. They're not reporting just based on having totally different populations working in the schools. So that gives more validity to our findings that there are differences in the school environments. The students in schools identified as trauma-informed, however, were more likely to receive free reduced lunch and be from historically marginalized populations. We found, I think this is pretty interesting, we found that every policy and practice we asked about was more common in trauma-informed schools. Not all of those were statistically significant, only 24 of them were, but that's an interesting finding that everything is more common in trauma-informed schools. And so it brings us to some additional questions that I present later. Then we performed logistic regressions. The final model included significant policies and the respondent demographics and school characteristics from prior regressions. Basically, I ran the entire series of generally expected practices and policies, and then the entire series of COVID-related policies separately. I tried factoring, that didn't work, so I couldn't streamline the regression any further. So then I just took the significant ones and put them in the final model. What we found is that trauma training for staff was 20 times more likely in a school that's identified as trauma-informed. That's great and pretty obvious. You would think that that would be the case. And we also found that resources for secondary traumatic stress and self-care were 5 times more likely. Everything else kind of washed out. One of the interesting earlier findings, though, is in the first regression model, the presence of metal detectors was found statistically significant in trauma-informed schools at about the same rate as the STS and self-care. So I think it was 4 or 5 times more likely. And that washed out when you put these other things in there. But that ties back to the focus on there's differences in student populations in trauma-informed versus non-trauma-informed schools. This is a big graph, and it's too much, but I just wanted to show you the policies and practices that came up the highest and the chi-squares and the percentages of those policies and practices in those schools. So, for example, the first policy and practice, trauma training for staff, was reported in 80% of trauma-informed schools, which is the second column, and 33% of non-trauma informed schools. And if you look further down, you can see the metal detectors were present in 16, almost 17% of trauma-informed schools, and only 5% of non-trauma informed schools. So moving on, the second study we did was about the culture and climate in trauma-informed and non-trauma informed schools. And we were wondering, again, if there are certain characteristics of trauma-informed culture and climate that could indicate whether the school was trauma-informed. As I said, the same instrument for the previous study as this one, but the culture and climate survey was designed based off the critical review that was done earlier, and it had a Likert scale for various questions about commitment to trauma, which is the culture piece, like does the school provide training around trauma, things like that, and then questions around safety, relationships, and a strengths-based equity focus. So those questions would be things like, is this school safe? Can I share my whole self at this school? Do I have a trusting relationship with my colleagues? Things like that. So again, we did means for each climate series, and then that was the independent variable, and the dependent variable was, is this a trauma-informed school or not? The findings from this study is there definitely were statistically significant differences in the means for trauma-informed and non-trauma-informed schools, and those were across every variable assessed. So not just the scales, so like not just safety, not just strengths-focused equity lens, but every single variable. So it is safe to discuss difficult topics. In trauma-informed schools, the mean was 3.38. And in non-trauma informed schools, the mean was 2.77. And so that means that in this scale, in trauma-informed schools, it's more likely. I can go back and show you again what the Likert scale options are. So 3.38 is well in the to a moderate extent, and then the 2.7 is in to a small extent. And then we did see some differences in perceptions by the personal demographics of the social workers, which we would expect. Climate is experienced differently by people with different personal characteristics, as we know. So Black social workers reported that climates were generally worse. Male and Hispanic social workers reported that some things were higher and some things were lower. So, for example, males tended to think the school was doing a better job in serving all populations. Hispanic social workers reported a stronger sense of belonging than other social workers. Again, I did a series of logistic regressions. Each one included one index along with the respondent demographics and school characteristics for constants. Safety. More reports of experiences of safety were 3 to 4 times as likely in trauma-informed schools than in non-trauma-informed schools. Social workers also reported that they were 4 times more likely to feel elements of a strengths-focused equity lens in a trauma-informed school. About the same, they reported higher quality relationships at about 4 times the experiences reported in trauma-informed or non-trauma-informed schools. And then the big finding, of course, is trauma training and commitment, which is that series of culture questions like, has this school made a commitment to trauma, responding to trauma? Do I receive regular training in trauma? Am I confident that I can recognize trauma in myself and others? So that was 25 times more likely in a school identified as trauma-informed. let me just say one more thing about these findings. I also later ran a logistic regression with all of the scales in it, just to see if one of them contributed more. And again, the trauma training and commitment is the primary difference. But I think it is important to note that there are climate differences too between trauma-informed and non-trauma-informed schools. So then study 3 is the one that I talked about that were interviews. We took a subsample of the survey participants. Basically, I just sent out emails asking if people would like to participate in the follow-up. And 20 responded that they did. 15% of those were, or 15 of the 20 reported working in trauma-informed schools, and 5 said they did not work in a trauma-informed school. And this was a group of heads of districts, heads of services in a district, social work leadership, and individual practitioners. So we asked them questions like, what would you expect to see in a trauma-informed school? What outcomes are you seeing as a result of a school being trauma-informed? What do you believe is the role of educators and administrators versus social workers? Here is the demographics for this sample. 19 of the respondents were women, 15 were white, 15 were school social workers directly, but we also had 4 district heads of services, which I thought was really interesting. Very, very experienced people. As you can see, half of this sample had more than 20 years of experience in schools. They also worked across the different work settings, but in this case, most of them worked in urban settings. And then they served basically like the other social workers across the range of different schools from elementary to high school. Most of that's actually incorrect. More than half were not in the Northwest. More than half were in the Northeast of the US, and then but all US regions were covered. We had social workers from California, from Texas, from Florida, and then New York, Connecticut, Pennsylvania, places in the Northeast. So the big takeaways from this analysis are that social workers believe trauma-informed schools require a holistic, systemic focus, not just the presence of trauma training or mental health services, that positive interpersonal connections are key facilitators to the development and sustainment of trauma-informed approaches in schools. And then this is a question I specifically asked them based on prior findings, and I think this is very salient in the United States right now with commitments to anti-racism, diversity, education, and inclusion being stripped out of all of our education system. And I don't know if that's true elsewhere, but most, but not all social workers believed that being trauma-informed requires also a commitment to anti-racism, diversity, equity, and inclusion. So an example of the first theme was this quote: "I don't think that you can have one program where a kid goes and it's a trauma-informed school. You need to have the lens of trauma-informed seep throughout the school, from administration all the way through to like lunch aides, school aides, security guards." As a sub-theme to the first theme, we took what they said about expected characteristics of trauma-informed schools and further fleshed out what they expected to see in a trauma-informed school. Of course, they said trauma training. Everyone needs to have that basic understanding, but that's insufficient to the creation of a trauma-informed school, they said. They also expected a focus on building community and developing a positive climate. They also expected positive discipline and restorative practices versus punitive, disciplinary, and exclusionary practices. And they saw positive climate as both a contributing factor and an outcome. So it was more like a circular component where it fed in, but it also continued to grow out of a trauma-informed school. So an example of the second theme is, in general, to be a trauma-informed leader, you need to provide empathetic listening to your staff, hearing their needs, providing that sense of safety, like emotional safety, and creating those brave spaces to have open, honest conversations, both in a group setting as well as individual. And then I'm going to share a couple of quotes with regard to theme 3. This is from the 14 respondents who did say there was a connection between trauma and anti-racism, diversity, and equity and inclusion. One of them said, you need to have a trauma-informed lens to really talk about equity, and you need to be looking at equity to really have a trauma-informed lens. Now, the remaining 6 usually used colorblind language when I asked them about the relationship between these different factors. So they said something like, yeah, they're related. When you look at what the actual goal is, it's to support the student. And so that's where the similarity lies. There weren't any clear demographic differences in people who took a colorblind approach versus those who didn't. However, all of those that took a colorblind approach were either from the Midwest or the East Coast. And more experienced social workers were more likely to realize that those two things needed to be connected. So I know that this organization supports practitioners and researchers and policymakers. So I have implications from this work for everyone. From the earlier research, you can see that there's metal detectors and softening approaches together in trauma-informed schools. So when we think about trauma-informed theory, we need to consider if those can be juxtaposed appropriately or not. We also need to ask ourselves why trauma-informed schools were more likely to have higher percentages of low-income and minoritized students. Is that intentional? Further research is needed. And then, like I said, why did trauma-informed schools have more of everything? Is it that they just have more money? Or is there something else going on? And then, like I said, are there meaningful differences in funding allocations between trauma-informed and non-trauma-informed schools? There's also practice implications for both education and social work. We've been doing trauma-informed training for a long time in schools. It's time to diversify based on what our understanding of trauma-informed approaches are, so that we're creating a more positive environment, so that we're including resources for secondary traumatic stress, and we're looking at policies and practices from the district all the way down to the classroom level. Social workers, in order to make these changes, need to speak the language of educators and administrators, and not just say, you know, giving kids social emotional learning helps them be happier and more well-adjusted. We need to tie it to the words that educators use around the importance of making sure kids know their 3 R's and are achieving the goals set by their various localities in terms of student education. And so that requires shifts in how we think of social workers. Social workers need to work not just interpersonally, but in more school-wide prevention efforts. That requires expansion of their roles and their workforce to build capacity, which of course requires school and district leadership support. There's also policy implications for education and social welfare. a big one is instead of mandating specific tools for practice, policymakers should advocate that schools meet certain standards for student support and learning, and then allow schools to use a combination of both ground up and district-led approaches in concert with EBPs that are focused usually on interpersonal connections. And then we should also consider decoupling state and local education funding from property taxes to address opportunity gaps and negative impacts on lower income students and communities. And then research implications. We did believe that race, poverty, and equity should be included in future conceptualizations and study of trauma-informed approaches. We think that differences in perceptions of trauma-informed culture and climate should be studied in one school. Now, this was across the nation, kind of as a test for this instrument, but climate study, of course, is really meant to be in one organization so that you can see how different people are perceiving the same environment. And then additional qualitative study of school culture and climate processes and outcomes, so we better understand how trauma-informed approaches come about and are sustained. And then that relates to individual and comparative case studies of these schools. We've published 2 articles from this work. These are the critical review is the top one, and the second one is the policies and practice differences. We have others under review. And that is all I have to share with you. Thank you so much for listening.